Hello, my name is Maartje. I am the nurse manager here at Aria, and today I'll be showing you how to do your Zivafert trigger injection. First of all, this is the Zivafert. Majority of our patients will be using 2 injections, but I'll be showing you how to do both. When you prepare the Zivafert, make sure that you have a clean workplace, and once you've opened the box, you will find a vial that contains a powder, a syringe that has the water inside, and 2 separate needles. I'm going to be showing you how to mix the powder with the water. Okay. So when you open up the package, you will find that there are 2 needles. The green one is a very large needle that we're only using for the mixing, and the grey one for injecting. I'm going to remove the purple cap here. You can just flip that off with your nail. Grab the water, remove the grey top, and add the green needle. You just remove the needle by twisting the cap off and pressing it on. Again, this is a very large needle. To safely remove the cap, just remove your hands away from each other. And now I'm going to be injecting the liquid into the vial with powder. You will see that the solution is mixed straight away. The easiest way to remove the liquid back into the syringe is by putting the needle in the corner of the vial and then pulling this up with the plunger. There's a vacuum in the vial that will allow you to draw this up easily. If you find that there's a little bit of water left inside, you can always press the plunger back in and repeat the process. Okay, everything is now in my syringe. I'll take this out. Now I've mixed the first one, I'm going to grab the second vial with powder and mix the solution with this one. Take off the purple cap, take off the green cap, and then I pierce this through and inject the solution in here. You can see the powder straight away turns into a clear solution, and again I'm putting the needle in the corner of my vial to draw everything back up. Don't worry if you see a few air bubbles, that is completely normal. If you find that there's still a little bit of medication left, please just press it back in and repeat the process. Once everything is inside the syringe, take out the big needle. The safest way to now change the needle is by scooping this up, twist this off, and I'm going to grab the grey needle that we're using for injection. Okay. I press it on, push your hands away from each other. Now, there might be a little bit of air in the top of your syringe. It's important to know that any air bubbles won't do any harm. But what you can do is you can always give it a little flick with your finger, and then just gently push up the syringe until you see a tiny drop come out. When you see that the solution comes out like this, your needle is primed and you're ready to inject. I'm going to show you where to do this. You want to be injecting the same area as where you've injected to in the past, which is your lower abdomen. Hold the syringe with one hand, grab the skin with the other, and you just inject straight in. Once the needle is all the way in, you can let go, and with your other hand you press the syringe down. Once the syringe is all the way in, you're going to count to 10 before you remove. I've just mixed Zivafert 10,000 units. To recap, I've used 2 powder vials with 1 syringe of saline, and you can see here that I have 1 spare saline left and 2 needles that I haven't used. If you are doing just 5,000 units of Zivafert, you'll just be using 1 water with 1 powder. Just as a tip, the syringe here has a white collar. It's important that you don't remove this. This will allow you not to pull the plunger all the way down and have a risk of losing the medication. So keep the collar on.